Well, we know early detection is the key to preventing heart disease, but not everyone has equal access to the screening and information.
This week's Changemaker is addressing that in communities all over Greater Boston. He knows what it's like to live with a devastating heart condition, and his foundation is saving lives.
Eating while you're exercising.
Bouba Dieme is a popular visitor at the East Boston Senior Center.
I like this table, yes. It means a lot to be able to help other people.
He and his team provide routine but vital health screenings.
So who's going to do the blood pressure today?
In 19 Greater Boston communities, they're engaging people with heart health information, support, and the free screenings.
They might come for the blood pressure screening, but they might have mental health issues. So we'll be able to connect them to those resources.
120/80 or below. So that's what's really good.
Raised in Senegal and educated in South Africa, Bouba was a 25-year-old graduate student when he was hit with flu-like symptoms and chest pain.
It was just tight here. So eventually I'm like, let me go to the ER, and then I went to the emergency room, and then they found out that my heart was bigger than normal.
Too big and working too hard to pump his blood. He felt isolated, shocked, and exhausted.
There was no patient stories I could relate to. So it was very, I would say, traumatic in hindsight. Yeah. It was very depressing.
Medication worked for a while, but in 2016, after he, his wife, and young son arrived in Boston, new testing revealed his problem was congenital, life-threatening. For the next 6 years, while he waited for a heart transplant, he relied on a surgically implanted mechanical device to survive.
How did you process this?
It's something I guess came from my upbringing, my personality too. But I always try to look at the positive side.
He became a dad again to twin boys, wrote a blog for other patients, and volunteered with the American Heart Association. He also saw the undeniable gaps in cardiac health resources, particularly in low-income and immigrant communities, which got him thinking.
We can do more than just the support groups. So let's have a structure, let's have an organization that will be there for the patient and support the patient.
In 2022, he received the transplant at Brigham and Women's Hospital. By then, he'd already launched his Heart of a Giant Foundation to address disparities and build community.
It gives all the meaning to my life that I didn't expect, 10 years ago.
Think of something happy.
Yanyant learned about the screening from his English teacher.
How did this go?
Yeah, that is very good.
It's extremely important because cardiovascular disease is the #1 killer.
Retired nurse Patricia Nunn says at this senior center, members' blood pressure is trending down.
If you have early intervention, then it's much better. You have better positive outcomes.
You keep up the progress because I'm very proud of what you've done. And
they're teaching me Spanish. My accents are terrible, and sometimes they laugh, but this feels like home.
Heart of a Giant provided 1,300 screenings last year alone and aims to offer even more this year.
Thank you for being here.
Okay.
It may seem obvious why Bouba named his foundation Heart of a Giant.
Gracias. Good health. How do you say good health? Corazón, corazón.
But this 6'8" chief inspiration officer insists it also refers to the foundation's generous supporters.
What changes in these communities because of Heart of a Giant?
We basically have healthier and stronger communities. That's why if we're all doing better, we're all productive, and I think all of that we can all thrive together.
He says they all thrive together because it is about trust and that human connection. Bouba tells me that it's not uncommon to identify someone in one of these screenings who's actually having a medical crisis that needs immediate attention. Heart of a Giant got 22 people emergency care last year who were in that situation, care that probably saved their lives.
Boy, what an impressive individual.
Yeah, with a mission and just this determination to get better heart health all over Greater Boston. Now, if there's someone in your community who's making a difference, we want to hear about that person. We're looking for change makers who are solving problems, addressing gaps, or just making someone's day. If you know of someone like that, let us know. Send us an email at changemakers@wbz.com.